A quick little introduction. Most of y'all already know who I am, but for those of you who don't, my name is Isabella Restrepo. My pronouns are she, they, ella, ella. You can call me Bella. I am a researcher at the University of California. My research focuses on the criminalization of marginalized communities throughout California, specifically as it's related to mental health services. The project that I'm working on right now looks at the criminalization of Latina girls who are in foster care. But more broadly, I'm especially interested in thinking about how my research can be leveraged to create forms of community care that aren't invested in, systems of carcerality, in the criminal justice system, in techniques of control and containment. I'm really interested in what it can look like to create mental health support for marginalized communities that don't rely on these really kind of traumatizing, violent ways of controlling people. And with that, I will pass it over to Ali.
All right, thank you so much, Bella. Good morning, everyone, and welcome back. This is our final series today. And I just want to say it's been such a pleasure to be with you in each of these sessions. I want to thank Sarah and Zara for turning on their cameras. So good to see some faces in these trainings. But yes, no stranger to you all. Ali Guajardo, LCSW. I've been practicing in Santa Barbara County for over 6 years with programs such as Wraparound, doing in-home crisis work and stabilization, specializing in with populations like CSEC, commercially sexually exploited children, Safety, which is our mobile crisis team here in Santa Barbara, and currently working at Santa Barbara Neighborhood Clinics, specializing in transgender healthcare and providing behavioral health, consultation, and therapy to other folks. For these trainings that we've done, I have been pulling from what I have come to learn in utilizing EMDR over the last 5 years and DBT over the last 3 years. And not only do I come here with, the knowledge from the books and the trainings, but I also come here with a passion to do this work simply because I have been a youth who was once in foster care. I have had both parents who dealt with addiction and currently a lot of family members navigating mental health. So the things I come here sharing with you all is not just from the work that I see, these treatments and modes of work being effective, but also things that I have implemented in my personal life. So overall, just again, really happy to be here and share these tips with you all. And if we can go on to the next slide, I want to give a little disclaimer here. So in these trainings, I have talked about EMDR skills and DBT skills, so dialectic behavioral therapy and eye movement desensitization reprocessing. And one thing I want to just make clear here is that I am pulling from these 2 modes of therapy to give you all tools and skills that can be used with our community members, family members, paraprofessionals, peers. So at all, we're not walking away at all trained in EMDR or DBT. So definitely not encouraging anyone to go and, implement these things. The skills that I've pulled from DBT, there's over like 300 skills, and I have pulled the ones that I have found most helpful in crisis response, but more effectively and importantly, ones that I've been able to coach families to use and use in their own life so that when we're out of the picture, when the clinician or the helper is gone, they have skills. And with eye movement desensitization reprocessing in the training I took, again, we want to be very careful of how we implement this. But one thing I was told in my training was that the tapping or the bilateral simulation that I've taught you all is something that I was coached that I can train paraprofessionals in after my training. And just another disclaimer there, I have taken these trainings, the full course trainings. However, I have not become certified in this. So there is a difference between being trained, which means you've done all the coursework and you've gotten a certificate, but then there's another process that is voluntary that one can go into, and that is to become what they call certified, which just means that you've taken the trainings and then you're doing whatever extra is required of these programs. So for example, with DBT, you get the certificate of completion, and then if you want to get certified, you have to pay registration fees, take a written exam, and then you have to do hours where you're implementing DBT being recorded, and then those that are trained and certified in it are kind of evaluating you. So it is a whole process, and that's the same for EMDR. With EMDR, they want 50 hours of individual one-on-one work with 25 patients. So it's the next step in my career, as I find these two to be extremely helpful. I've definitely been thinking I need to get the EMDR certification because I find it very helpful. So just wanted to give a disclaimer on that. And then the two links that I have up here for EMDRIA, that is where you can go to find trainers that have been certified by EMDRIA. Or if you were looking for a therapist who specializes in EMDR, they can be found at that website. And then for DBT, same thing, dbtlbc.org. That is where you can find trainers that are certified in this, as well as clinicians. And so just wanted to give that disclaimer before we move on with this session, so we can go on to the next slide.
Really quickly, to kind of bring that all together. So the tools that are being taught here are based in EMDR and in DBT, but it doesn't mean that any of us are walking away certified and prepared to practice EMDR or DBT. But we are walking away with the tools that that Ali has shared with us, and we can use those tools, right? We can use them. The families of the folks that we work with can use them. Our community members can use them. These are tools that anybody can use. So it was important for us to make that distinction. All right, so session 8, building bridges. So today we are going to focus on the application of the interventions and the skills and the tools that we discussed through this 8-part series. If there were any sessions, we'll be referring back to the sessions that we've already done. So if anything comes up that you're unfamiliar with, or maybe you might have missed that session, do not fear. All of the sessions are recorded and you can access them through the CARE TA Center. The recordings get sent out in the follow-up email. So you will be able to access any material that you may have missed from previous sessions. So today we are going to collaboratively think about what it means to utilize and to implement the tools that we've talked about. This session is really an opportunity for us to ask the clarifying questions that we haven't been able to ask, to request additional resources. We have a couple of case studies in this that Ali, that really, the idea behind it is to kind of illustrate how in practice the things that we've discussed look. But really, I think that the main thing that we're hoping to kind of pull out of this session is community conversation, right? We'll review a few things, but really we're hoping that we can use the bulk of today's session to reflect on what we've learned from each other throughout this cohort series, to share what we found to be most helpful, how you feel we can improve. What are, maybe there are some tools that to be really, really beneficial that we haven't talked about. We would love to hear what those tools are, right? Because the idea behind this cohort series session is that there is so much knowledge already in this room, not just from Ali and I, but from all of the people that have all of you, right, that have already been doing this work, that are on the front lines, that have this entire kind of treasure trove of experiential knowledge and wisdom that is really powerful. And I think that if we can be in community with each other and share what does work for us, what doesn't work for us, then we can collaboratively think about what our communities need and how we can implement those things. So that's generally what we're hoping to get out of this session today. Next slide, please. Before we get into it, I want to say really quickly that the reason we called this session Building Bridges is because that is really, and I should have said this in the last slide, right? So this is for the title slide. None of these words are related to what I'm talking about right now, but we called it Building Bridges because that's really so much of what our work has to be, right? No matter what our role is, whether we're a clinician, whether we're a community member, whether we are, at the front desk of a center, and no matter what our role is, the work has to continue in that we build bridges between our communities and modes of healing that don't rely on carceral logics, on criminalization, or on containment. And we really hope that these sessions can help us build those bridges, or at least start developing the tools that we need to be, one step towards building that bridge. I want to start us off with a quick review of what we've discussed throughout the series. So if you look up here, the different kind of sections up here are things that we've discussed, and I'm going to connect all of these for us in a narrative. So we know, right? We started off this session with a conversation about criminalization. We've all seen the impacts of criminalization in our communities, especially if we're working in BIPOC, low-income queer communities, we know firsthand what this can look like. So we know that BIPOC communities, queer communities, low-income communities, and other marginalized communities are forced to navigate systems that consistently criminalize them, including, unfortunately, helping systems like mental health services. So to reduce this criminalization, to divert marginalized communities from the criminal justice system, and really to create more equitable outcomes for Black, Indigenous, and people of color, and queer folks who we have to practice through an intersectional lens, right? None of the work that our communities need can happen unless we are recognizing the fullness of their identities, right? The fullness of their humanity and what that means for the ways that they move through the world. Intersectionality, I know, is a concept that people talk about all the time. It feels really big, right? But there are practical ways that we can incorporate this. So if we think back to, for example, the Addressing Identities tool that we talked about a couple of sessions ago, this is an example. It's not the only tool, but it's an example of a tool that can help us start the process of thinking about the people that we work with in a more nuanced, more person-centered way. This tool is really helpful in conducting intersectional assessments. It gives us a place to start in exploring and understanding the ways that people's lives are impacted by overlapping privileges and oppressions. And it's not just a tool that we can use, with the folks that we work with. This is also a tool that we should be using for ourselves, right? It's a tool that invites self-reflection. If you have the time, I know a lot of us may not have the time, but if you have the time to sit with this tool and fill it out for yourself, it's a really powerful learning opportunity for us to think about not just how the people we work with move through the world, but how we move through the world and how that can impact the work that we do. Or even with your colleagues, maybe you have a weekly meeting where, you guys have dope discussions, and this may be something that you bring into those weekly meetings to invite all of your colleagues to do together. This insight really allows us to do work that centers the people that we're working with, because it gives us knowledge about ourselves that is necessary to do person-centered work. So practicing through an intersectional lens means that we are also using trauma-informed, person-centered approaches to our work, especially in crisis response, where people are already so vulnerable. To practice person-centered approaches that provide the most autonomy, we have to engage in proactive work, right? That proactive work is crucial. And this is where we can teach things like the distress tolerance skills that we talked about. So if we think about the skills and the tools that we discussed, there is the tip skill, there is the stop skill, the bilateral stimulation, mindfulness, the paired muscle relaxation. There's this whole slew of skills and tools that we discussed throughout the cohort series. Maybe some of them are helpful to you, maybe none of them are helpful to you, and that's okay, right? The idea behind this is to show that there are tools that we can add to our toolbox to help us navigate crisis response, mental health crises, and supporting our communities in a way that gives them autonomy, right? So if none of these tools work for you, that's okay. What that means is that, there just has to be conversations with the folks that you work with to figure out what may work for them. But even with all of the skills in the world, right, we may still find ourselves or our community members dealing with the mental health crisis, right? Because skills alone are not going to solve the underlying issues that cause something like an inequitable mental health system, right? It's a tool to help us support our communities, but it doesn't resolve the issue. So when we do find ourselves navigating a mental health crisis, or community members dealing with some kind of mental health crisis, when those crises do arise, an assessment of the brain state, referring to the brain state quick tips that you can find on our link tree, is incredibly helpful. And the implementation of the Act Quick model, which again you can find in the link tree, can help us figure out how to de-escalate the crisis situation that we're dealing with and offer the people that we work with the utmost support and autonomy in their care. So the interventions and the skills that we discussed throughout the series are tools. And again, alone, there's no way that they can resolve the far-reaching issues that create this inequitable mental health system that we are working with, that we are navigating, and that our communities are navigating. But they can help us in mitigating the harm that they create, right? There's no way that any one kind of intervention is going to resolve all of the overarching issues, but we can each do a little bit of work, like learning these skills, tools, methods of engagement, intersectional lenses, to offer our community members the types of support that they deserve, right? This is a kind of a drop in the lake, right? But with enough drops in the lake, we can totally change the temperature of the water. So this may look very different for you in your workplaces, but we do hope that the skills, the tools, the theories, the discussions that we've had throughout the series can be helpful to you in working towards building those bridges that your community members need. All right, next slide, please.
Okay, so Bella, I like the way you just concisely kind of put everything in a nice little package for us in terms of what we reviewed over these last couple of weeks and how it all ties together. So with that, we kind of want to turn the table here. You've been hearing from us a lot. We'd love to hear from you. So we want to take this moment here to kind of pause and just reflect on kind of what we learned. So we have 3 questions here that we'd like y'all to take maybe 3 minutes to kind of think about. You can write it out if you want, or just kind of take a mental note, but we'd like ask you to think about what are things you're going to consider doing. So with everything that you've kind of learned in this training, conversations we've had, what are some things in your mind that you are now considering either beginning to implement, take out? So things I'm going to consider. Then we're going to ask you to think of things you're going to start doing, right? Is that going to be proactively developing a safety plan with each of the people you meet? So kind of just thinking about what are some things you want to start doing. And then as always, we want to hear more from you because we want to make sure the care team as well as us and other trainers are giving you all what you guys want and need. So things that you all look forward to learning more about. So if we can take a good 3 minutes here to just reflect on these 3 things, and then at the end, we'll kind of share and see what you all came up with.
Yeah, and you can feel free to, engage in whatever way feels right to you. If it's better for you to just type them into the chat and drop them in there, that's fine. But if you would like to speak, then you can just raise your hands and we'll indicate or we'll call on you. So yeah, take a couple of minutes to think about this. And when we're thinking about things I'm going to consider, it doesn't necessarily have to be things that you are going to implement, but maybe there's some things that you are going to start thinking about or going to start, really kind of centering in the work that you're doing. I would like to share something that I'm going to start considering. So, in one of our early conversations, Will shared about options in their center where for people that are in crisis, they have access to a peer support person, right? And I think that in so much of the conversations we've had, and especially in the work that Ali and I have done in our communities, what we've learned is that peer-to-peer support is often a lot more powerful and a lot more beneficial for the person that is navigating the crisis, than having a worker that they don't know come in and try to support them through a crisis situation. So for me, I think that one of the things I've learned through this series is that, these tools are amazing, but what I really need to focus on is figuring out how we can get these tools to peers, right? To high school students to, implement with their friends, to the college age kids that that live all throughout our communities, right? To the parents and the grandparents who are navigating, so much in terms of supporting their youth while also, navigating mental health crises themselves. So for me, I think that what I really want to start thinking about how I can incorporate in my community is more peer support. I agree. Learn more about how peer-to-peer support can be used in an effective way. 100%. I think that, yeah, especially from Will's conversation about this, it's clear that this is an incredibly powerful tool. And in the work that we've done, right, we've learned that, especially for youth respond better when it's somebody that they know, who they are in conversation with when they're having a crisis. So it seems that our communities really do need, right? We don't need more, we need funding for sure, right? I'm not going to pretend like we don't need funding, but we also don't need, cops or, social workers. Social workers are amazing. Okay, Ali's a social worker. But we need each other, right? Our communities need each other to be prepared to help ourselves and to help each other navigate these incredible crisis situations that come up for so many of us.
I'm just aware of like how important it is that when we do this work, that idea of cultural humility and how we're all learning and bringing ourselves to this work, and the importance of being able to like receive feedback and give feedback.
Thank you. I think that previous one touched on a lot of really important and good topics. For myself, like where we're at in the rural area of California, in Central California, I think that's also very necessary, right? Visibility as far as like when I peer support or when showing up as far as BIPOC, LGBTQ, and being the leaders with lived experience in those spaces. I think that our youth is missing that a lot right now. Especially out here, we have a lot of country, a lot of dairy farms, a lot of just agriculture. And yesterday was actually my first experience in doing outreach at a primary school in a very rural small town. And it was really awesome because, we're LGBTQ, we're also brown, and we're implementing stuff like health and wellness, So being able to consider continuing an open mind when having conversations with, say, someone who is a native there in Waterford, California, and grew up with obviously this person in particular that I spoke with was a white male, very conservative, but very open and curious to what it was we were doing. So being able to myself continue to be open and communicating in a way that is not necessarily implementing my beliefs or how they should think or act, but just kind of keeping the open conversation that, hey, this is just information that everyone should know. And like we intersect within every single community,
Right.
youth all the way up to seniors, and being able to hold that conversation in a very loving and graceful way, because it also helps me learn about myself, right? So yeah, it was really nice to kind of share that and see me give the information as far as what we were doing, especially in elementary school, and them being a little bit put off by it. And then me mentioning the programs and resources that we have, like our medication assisted treatment program for substance use, and all the behavioral health services that we offer for youth all the way to seniors. And then I was able to throw the LGBTQ BIPOC in there as well, that we represent as an organization. So it went from him making kind of a face to like, oh wow, shaking my hand and saying, hey, y'all are doing some really good work. So I guess for me, considering to continue those open conversations with any realm, any person, any life, like any age. So.
Yeah, beautiful. And I think that what is really standing out to me, Alexander, and what you're saying is an understanding that the needs of rural communities are going to be very different than the needs of a community that is more urbanized. Especially because I think that for a lot of us that do come from very urban settings, from big cities, it's really easy to think about, insular conversations as opposed to conversations that are including community members that may not necessarily be in line with the ways that we're thinking. That's really hard work. I can't even, it's difficult work, right? For me, I know that it would, it brings up my heart rate and I get really like, let's fight. No, I'm just kidding. But
I know the Latin in me comes out real quick. No, but yeah, I think that's really important. I actually am from Orange County, Los Angeles area. So coming out here was a huge culture shock in my youth.
Right.
And now I've learned to love it. But yeah, it's unfortunate, and I want to continue to strive and consider, that open mind and that learning portion about it, to bring all of these changes and all of those resources and every portion of it to the Central California.
Absolutely. Thank you so much, Alexander, for sharing that.
Yes.
Any other thoughts before we move on? Things that you want to consider doing, things that you're going to start doing, or things that you want to learn more about? I mean, there's so much that I feel like I have to learn about still in relation to all of the conversations that we've had. Go ahead, Eliana.
I'm just aware of like how important it is that when we do this work, that idea of cultural humility and how we're all learning and bringing ourselves to this work, and the importance of being able to like receive feedback and give feedback. And one of the things I'm so grateful, Alexander, that you just shared, what an incredible share. And at the end, I heard you made a comment about it brings out the Latin in me. And I think what you were referring to was the idea that some part of your Latin ancestry is prone to fighting. Is that what the joke was? Oh, your mic is off.
Yes, sorry if I was culturally insensitive when I said that it brings out the Latin in me. But yeah, the resistance, growing up in a, having parents who are immigrants from, would we consider Mexico a third world country?
It is a country that is, there are many words to describe the country. And I think what I'm hearing you say is it's a country that doesn't have a lot of resources, and there's an imperialist relationship with the US and so on. Yeah. So you're talking about the fight is when power dynamics are different. And is that where you were going with that?
Yeah, I've felt resistance growing up in certain areas, especially my background is in sports, is like swimming and water polo, which is very conservative out here. Very, it costs a lot of money. So I guess it stems from a lot of maybe my childhood trauma or something, or the way that I grew up in certain surroundings and stuff, and being treated the way I was treated. So it could be a little bit of that.
Well, I think it's great that you took an opportunity to like kind of explain a little bit more, that when you said it brings out the Latin in me, you're acknowledging that your family members who have come to the United States have done so in an environment where they've had to really work really hard to make it for themselves, for you, and for others. And so when you said the fight, it could have, because it was a short statement, it could have been interpreted in any number of ways. Because Latinos are also super peaceful people. And what you were referring to was that larger power dynamic. And so I think you and I have just taken an opportunity to really demonstrate that what it means for us to pause for a second and just be like, oh, you said something I don't understand entirely. Can you say a couple of sentences more? And that allows us to have greater understanding with each other, at the risk of, if we just moved on, it could have been misunderstood by others. And I think that Ali and Bella, you encourage us to talk directly about like when comments or things come up.
Yeah, thank you, Eliana, for bringing that up. Alexander, when I heard that, what immediately came to my mind was that we are, so many of us are from a people that have had to fight in really kind of difficult ways for survival and for life and for joy. And so that's what I heard when you said that. So yeah, I appreciate that conversation. And then I'm gonna redirect us back to the questions here. So Luna says, the impact of my, number one, the impact of my words, how I talk about my own experiences to avoid re-traumatization and encourage healing. Number two, taking better care of myself and being a living example. Yeah. Ooh, that is, if I could clap without hurting your ears right now, I would. Being as supportive as I possibly can and balancing community support and professional personal boundaries. You said so many important things here. And I just want to focus really quickly on what it means, right? Taking better care of myself, because I think that for so many of us, Ali and I were just talking about this, right? For so many of us, the work that we do, burnout is impossible to avoid. We always have conversations about how do I avoid burnout, but because we're working under these, really capitalist exploitative systems, so often burnout is just a reality of the work that we do, right? It's not something that we can necessarily avoid, but it is something that we can proactively address. And so I love this kind of idea of making sure that you're putting your mask on to make sure that you are in a place where you can support other people, and then being a model of what that means, right? For so many of us, right, we come to this work out of a deep love for our communities, right? Out of experiences that we've had. My parents are also, I'm the child of addicts as well. And so thinking about what it means to be in a space that can be re-triggering or re-traumatizing for us, and modeling for the people that are in community with us, what it looks like, right? It's not that we're never triggered, right? It's not that our kind of fight, flight, freeze, or fawn response is never up. It's that, we hope that we have tools to be able to navigate it before it turns into an explosion or a crisis, right? So I think that modeling is something that we don't consider important enough, but it's incredibly important, right? This is how we learn. We see people that we value, shifting the ways that they're moving through the world, and we realize, oh, actually, this is something that's available to me too. I can do that too. So yeah, thank you for pointing that out, Luna. And Alexander, I would love to continue this conversation. We're in a semi-rural community, and there are so many needs here that aren't addressed. So maybe we can connect afterwards, so I can learn a little bit about the work that you're doing, because it sounds really powerful. And then Guadalupe says, can I add that when we talk about quote unquote burnout, often sometimes our agencies turn, ooh, yes, 100%, right? This is such a capitalist tactic. Oftentimes some of our agencies turn that back on us and blame us for not being able to delegate or allocate our time appropriately. That's 100% accurate. And I think that so much of, in thinking about Luna's response, right? Like having boundaries, so much of it is also boundaries with our workplace, because we do very often come into workplaces with an expectation that, we're going to be pulling really long hours with very little breaks, constantly available. And there's no kind of recognition of the toll that this kind of works can take on somebody's body, on their spirit, on their mind. Right? Ali and I just had to have a conversation about how to keep his blood pressure down, you know, because this is something that has come up with the work that he's been doing over the past several years. And so I think it's really important for us to think about burnout in not necessarily in a way that is, you know, it's something that we can solve, right? We can self-care our way out of burnout. That's not true, right? Because burnout is the symptom of these capitalist, you know, ways of thinking about labor. So thank you so much for pointing that out, Guadalupe. And I think that it's important for us to recognize how sometimes we are gaslit by our workplaces, right? So thank you for naming that. All right, y'all, I appreciate all that you've shared with us. Ali, did you want to add anything?
I want to say, just in relation to what was just going on right now in terms of this conversation on burnout too, even thinking about that and taking an intersectional lens to that piece, right? And I have seen this, again, only in my work. I'm going to speak from my experience here, but in Santa Barbara, we have, you know, Latinx and white clinicians. And time again, as I was a supervisor to the wraparound program, there were conversations about the workloads that women of color took on versus the workloads that maybe white colleagues or counterparts had also taken on. So that was always a discussion when talking about burnout and the balance of, you know, how much of this is like taking on extra work because there's an expectation that, right, you're going to want to work hard. So just thinking about like race when it comes to that, but also as a trans person, I want to say, like, I enjoy doing these trainings just because it's a passion, but it is something I've had to get to a place of doing, because for a while it was, I work my 40 hours. I don't think I should be the one. Why are they asking me to put on this training? I'm going to have to develop this. And they're not taking into consideration like how much time and like emotional work it takes to prepare a training. Like if you are LGBT or trans or even BIPOC and you're being asked by your agency to, hey, you know, we see you're really passionate about this. Can you create a training? So just wanted to throw that out there, that those are some things that like I've noticed and had to come to like conclusions that, hey, okay, I want this work to be done, but I don't want to burn myself out. So how do I find this balance of, you know, doing what I need to do, but taking care of myself, but then also feeling this passion that I have to train and to give, you know, insight to those that maybe don't walk in my shoes or things like that. So that was just another piece I wanted to add there.
I did want to say that in response to what Ali just mentioned, you know, I think that this is something that is incredibly important for those of y'all that are working within centers, within clinics. You know, very often when we come from these marginalized identities, our workplaces will ask us to put on these trainings, these cultural sensitivity workshops, you know, other forms of engagement for our coworkers that our workplaces don't compensate. Of course, we're not talking about the CARES TA Center, we're talking about our kind of 9-to-5s, right? So for those of you that are in positions of leadership in your roles, you know, I want to invite you to really think about what it means to properly compensate the folks, you know, maybe in your workspaces that are being asked to put on these trainings. What are the kind of expectations that we're putting on the shoulders of our coworkers that are most marginalized? If you work in a place, you know, especially if you're a social worker, we know that there are so many social workers who are white women. And so very often, you know, what we've seen is that for clinicians of color who are working in spaces that are largely filled with white women, a lot of the labor ends up falling on the people of color. So when we're talking about, you know, kind of awareness of ourselves, it's awareness of ourselves in our communities, but also in our workspaces, right? With our colleagues, with the people that we're doing this day-to-day work with.
Wow, you guys just triggered a lot for me in terms of what you guys are sharing, and I'm so thrilled to be here. I did want to just kind of point on something that at times, you know, within this like social services, that's where I work, that at times you do have to buck authority and stand up for, you know, our culture and our Latino families who, there's a lot of barriers. And at times I've had to say, you know what, no, for example, in adoptions where I've said, no, this family, and it's not, there's very serious concerns in placing these children in this home. And I've had to go and say, no, I'm not signing off on this. But that toll that takes, because you're going against authority. And unfortunately, you do get blacklists to some extent, like you're defined as resistant, non-cooperative, all these negative terms when you're only advocating for the best for the kids that we serve.
Yeah.
You know what? And this is, I think, something that is incredibly connected to what we've been talking about, right? We've been talking about how carceral logics kind of infiltrate into all mental health systems in these really kind of insidious ways, right? And what you've just pointed out is how they also infiltrate our workplaces, right? These kind of, like, all of the language that you just use, it's carceral language, right? They're uncooperative, it's pathologizing language. They're uncooperative, they're, like the problem child, all of these kind of ways that people who resist, that people that insist on change or insist on better conditions for our communities get labeled as, as a problem. And so I think that what this shows us is a really clear overlap between the ways that carceral logics, carceral languages, and the ways that we think about how people should engage in the work ends up trickling into our positions as, employees of this center or employees of this clinic. So yeah, thank you so much for naming that. Okay, I think that we have to move on to the next session. Ali, do we have time to continue this, or Ali is our time?
Yes, we will have time to continue conversation after this next little slide here that I just want to review, and then again we'll give a good portion of time to chat.
Yeah.
So I want to encourage these conversations to keep going as we carry on here. But okay, as you see here, this slide kind of hits on what we had talked about last session, right? Where we had, these phases of the crisis care continuum here. And so I just want to briefly go over these. Again, I want to say that it is very clear here that everyone in this room today has a passion to learn. And basically, I get the sense a lot of you are dedicated to transforming the type of care that our communities receive. Again, to be more person-centered, trauma-informed, to reduce the reliance of law enforcement or psychiatric hospitals. So in this discussion, again, inviting you all to think through what equality can look like in your communities. For all of us here, what this can look like is, again, transforming this crisis continuum so that marginalized communities have autonomy in their care. So what can this look like? Just again, reviewing in terms of the prevention, right? The goal of this stage is to manage and prepare for ourselves as the other person for any potential crisis, and then develop an immediate kind of contingency or care plan that we can for when we need to respond to the crisis. Right. So in early prevention, again, doesn't matter what role we're in, we're always looking to ensure that all of the needs are met. These are not just food and housing. These are medical needs, like Ileana had mentioned in our last session as well. When we think about the LGBT community or trans and gender diverse community, we're also talking about, like, in ensuring their needs are met. I want to elaborate here that we're also talking about, like, the needs around gender expression. What are the clothes that I choose to wear? What are the mannerisms? What are the activities that I choose to engage in, or around gender identity? So some of the things we can talk about in prevention for trans and non-binary folks are going to be clothing, right? If parents are unaccepting or finances are tough, it can be expensive to change your whole wardrobe. So if there are any resources in your community that have, thrift shops, swap shops, where you can go and give clothes, binders. I know a lot of places now are creating, like, donate your binders so that we can give them to youth or folks that need them and don't have access to them. Packers for trans men, makeup, wigs, dresses, shoes that are in, heels that are in bigger sizes to accommodate all forms of women. So those are also things that can be preventative, is linkage to those things to ensure that they are able to, like, express themselves in their gender identity and gender expression.
So when we think about ensuring that needs are met, this of course includes basic needs, but when we're practicing through an intersectional lens, it also requires that we think more kind of thoroughly and more in a nuanced way about what the needs of the particular people that we're working with may be. What are the preventative things that we can do that'll kind of help them navigate if it's gender dysphoria, for example, that they're dealing with? What are the preventative things that we can do, like giving them access to clothing and to gender affirming
treatment.
tools, you know, makeup, hair, all of the things that Ali mentioned. Think creatively. What do they need outside of their basic needs?
Yeah, and then also in taking into account that intersectional lens, right, with the addressing tool, just making sure we are actually asking and exploring all forms of their identity. Because like I said, in my work, sometimes I try now to be more mindful of it, but in the past have really made assumptions based off someone's presentation and felt like, I don't need to ask for pronouns, or, oh, I don't need to ask for their sexual orientation. Because again, I'm making assumptions here, and then I miss something, right, in that early prevention. But what this has looked like for me in my work as like trans healthcare has been having conversations with families who come in about what's the difference between gender identity, gender expression, you know, gender, sex and gender in general. We have discussions. And these are, again, like proactive kind of preventative conversations that I can have with the family, so that if and when the child decides to come out or has shared, yeah, I'm trans, there, that prevention work is already being done. So just wanted to throw that out there. The second part of this phase, right, is early intervention. So this is when we're actually getting linked up with the service or already engaging in a service that is going to help us meet our basic needs, or emotion regulation, psychotherapy, anything along those lines. So when thinking about resources, again, tailoring this specifically to BIPOC and LGBT folks, again, we want to make sure that the resources they have access to are things that are within their kind of layers of identity. So again, in my work, what this has looked like is getting someone here as they tell me they're trans or coming out, and the first thing I ask is, okay, what's family like right now? What are friends like? Okay, we don't have any family or friends that are supportive. Let's get you tapped into a peer support group, or, you know, a resource center that has that. So definitely being intentional about what resources we're going to link in. And then teaching and coaching, again, this is an area where we are able to really teach and coach some of the skills that we've talked about in this training, or whatever else you are working on with them. That is the time to do that. And again, being mindful of, specifically, I'm going to speak to trans folks, right? But again, all marginalized groups in general. If we're going to do mindfulness meditation, again, being mindful of, you know, what has their experience been? How comfortable are they with these modes of skills and therapies? And then lastly, again, we want to ensure, I guess I missed it on the first one there, but prevention, again, we want to make sure we get that safety plan going. So the conversation in prevention is, what am I worried about? What are the things that we anticipate can happen? And then in early intervention, we're now kind of revising that safety plan, adding the strengths now that we know the person a little bit more, and we're adding the supports, or we're assessing and getting those set up. Then we're going to look at intervention, right? So this is when the person is actually in crisis. And again, not all of us are seeing this in the work we do, unless we are a crisis response team or a resource center where folks are coming in. But we added here all the skills that we would use, right? We want to access that safety plan. Again, ideally we'd have one, but if not, we're going to end up developing one after the crisis or the intervention. But the brain state, again, we want to make sure we're understanding what the brain state is, because when we understand the brain state, then we know what our next step is going to be. Am I working to make you feel safe because I see you're in survival brain? Or am I working to make you feel comfortable and connected because I see you're in, you know, emotion brain? So that's going to be, I think, one of the biggest tools that I've used. And then diving into that act quick model, maybe incorporating some bilateral simulation. Hey, you know, I can see you're really worked up right now. Would you like to take a walk with me and tell me what just happened? Again, getting them through that movement, encouraging a stop skill, engaging them in a tip skill. But again, this is all going to be very individualized. And I want to say, again, when thinking of like the LGBT trans population, in my work here in the last year, I have come to find that almost every instant of suicidal ideation that I have been in contact with in relation to trans and gender diverse folks has always looked like the emotion state of the brain, not feeling connected, not feeling loved. It's never this aggressive kind of wanting to fight or be confrontational. It's usually, I'm sad, I'm hurt, I don't want to be here anymore. I'll never be a man in the way that I see myself. And with every single one of those, I have been able to use, assess the brain state. Okay, they're an emotion brain. So how do I connect with them? And through that varies each time, right? Depending on what I bring into the room and what that other person is bringing into the room. So I had one example there of, actually, I'll talk about that in the next slide. So we'll hold off on that. But next piece here, again, in thinking about the crisis continuum is postvention. So this is after the crisis has happened, the work we do once the crisis has already taken place. We want to follow up to ensure the person's recovering as well as possible, has the supports they need and resources that they need. So again, we are revising the safety plan with anything that might have been learned in the crisis, the intervention part. What did I learn? What can I learn from this? We're going to also strengthen. Again, as you can see, there's a theme in a lot of these, but we want to, when we walk out of this person's life, we want to make sure if you are one person walking out, ideally, I would like to see you replace yourself with 3 additional natural supports, right? And this is something, again, that we are doing through all these phases. So in this kind of taking a person-centered approach, again, building on their strengths, building on their supports to create a safety plan that is going to be accessible when a crisis happens, that really is individualized and tailored to that person. And again, when we are meeting folks in crisis, very often they are unaware of what skills they can use. They're unaware of the red flags or warning signs that come up. And a lot of folks will say, I don't have anybody. I don't have anyone. So then again, we know this work is going to get done in any phase of the crisis continuum.
And if I can just interject really quickly, right? For a lot of folks, I think to speak to what Ali is saying right now, there may not be natural supports that they have access to in that moment, right? If they have estrangement from their family and they're in a new place, haven't been able to make friends, part of the work that may be required under preventative work and early intervention is figuring out how you can help build that chosen family for them. I think that it can be, people are incredibly discouraged, right? When they come across someone who's like, I literally have nobody, I have nobody. But this is the reality for so many of our community members. And so our role then is going to be, okay, well, how do I get you people, right? What are the spaces in our community where I can connect you to people who are navigating similar things as you? What are, if they're a spiritual or religious person, the church spaces, if they're in school, what are their school groups? All of this requires for us to be creative in figuring out how do we get this person connected. So there may be times where we're working with somebody that doesn't have anybody. That's okay. There are still ways that we can support.
So to just kind of wrap this up here, again, if we have a safety plan that was done proactively, all of their needs are met, and we are taking an intersectional lens to what they may be navigating, I can assure you if we catch them in prevention phase, we will not ever hit a moment of crisis. And if we do, they are going to be able to regulate. In early intervention, same thing. Crisis can happen because they're already in the service with you. But again, if we have that safety plan and we're doing the teaching and coaching, it is going to be easy breezy to walk them through a crisis. And again, maybe I'm just making it sound easier than it is, but I can tell you at the end of the day, folks are humans, and what they need you to do is just come to them with a very humanistic approach and conversate with them. And then again, in intervention, if we're using these skills, there's going to be very low chances of needing to call law enforcement or initiate a hold. Again, in the crisis I've shared with you, I've had 2 times where law enforcement, and again, we encourage them to just, hey, can you just stand back while we go inside, get the situation under control? And if and when we need you, or it happens to escalate, then again, we have our backup there, because at the end of the day, we need to take care of ourselves too. And then postvention, right? After every crisis that happens, we're having conversations, we're revising the safety plan. And again, in postvention, we want to see these moments of crisis happen less and less. And again, in wraparound, when I did this work, there were so many times that we would get a referral that said, oh my God, this kid's called safety, they've called law enforcement and RAP. And there was a joke that like RAP was just like the best program in Santa Barbara because we were getting folks that should have been referred to safety's program. But again, with all of my 5 years in wraparound, 4.5 years of wraparound, not once did any of my staff call law enforcement or initiate a hold because wraparound was crucial on the safety plan. And in retrospect, I think, why did RAP never have these issues? And I always thought, well, we did the safety plan from day one. And then we kind of coached the parent or the kid on how to regulate. And then we went out to the crisis and coached them on these skills. And then after the crisis, we went out and had conversations with the resource parent or the mom or the aunt or the grandfather that was taking care of them. And then again, taught them these skills so that they could implement. So again, with all of these interventions here, we're going to see hopefully a reduction in needing to rely on that system of support.
Yeah, and the reality is, right, that a lot of the crisis situations that our community members go into are based on things that are out of our control, right? They're based in the violence of navigating a system that doesn't care about them in the ways that it should. And so crisis is not going to always be avoidable, right? But it can be the trauma that comes from experiencing a crisis, especially when when law enforcement is involved, can be reduced by the early work, the early intervention, the post-crisis work. There are ways that we can support our community members through navigating a crisis that we know that crisis is unavoidable. It's going to happen, right? How do we mitigate the harm that we know is going to be caused through that crisis? So that's ultimately the goal of the work that we're doing. All right, Yali, thank you for breaking that all down for us. Do you have anything else that you wanted to add to this before we move on?
No, we can go on to the next slide there.
Okay, cool. So we want to invite some more reflection here. Again, just thinking about the treasure trove of knowledge that you all already have in your roles, what are some things, and based on the conversations that we've had here, but also just based in your own experience, right? In your experience with work, in your life experience, so many of y'all, occupy the identities that we've been talking about, right? These marginalized identities that are criminalized by these larger systems. So based on your work, based on your experiential knowledge, what are some things that we can do in our roles, or you in your role, to create more equitable outcomes for marginalized communities who are accessing crisis care? What can that look like for you in your role? I know that for me, as somebody that is connected to some youth who are in our communities, after the session, I realized that I'm actually not using the safety plan in a proactive way, right? I'm not being proactive enough about it. I'm the faculty advisor for an undergrad organization here at UCSB. I also work with youth in our local community, and I'm like, why have I never brought the safety plan to either of these spaces? I'm not in these roles. I'm in these roles as a kind of mentor, as a faculty advisor, but that doesn't mean that I can't be having conversations with the people that I'm in community with about how we can prepare ourselves, because even though I'm not in these roles as a mental health professional, there are crisis situations that have come up that I've had to deal with, right? Undergrads who are navigating suicidal ideation, extreme pressure, lack of resources that have triggered really intense mental health crises for them. So I've realized that I can be a lot more proactive in the ways that I'm thinking about safety planning. And then Zar says, provide resources and make resources accessible, provide resource with different languages. This is important. We, like I mentioned earlier, we are in Santa Barbara County, which is semi-rural. We have a really big Mixteco population here, and we only have one organization that does translating into their languages. There are there's so many resources that the Mixteco community here ends up not being able to access because of language barriers, because we have these documents in English and in Spanish, but we don't have it in Mixteco, we don't have it in Zapotec. So there are huge language barriers that the indigenous communities in Santa Barbara County are dealing with because of, just lack of language access or language support. Bringing up those difficult discussions and allowing a safe space to discuss, yes. So often, the community members that we work with have never had a space where they can talk about how crappy it is to be, somebody that is low income in Santa Barbara County, surrounded by, we are in a county that has extreme economic differentials, right? There's extreme economic inequities in our communities. And so often they haven't been in a space where they can talk about what this means for them or for their kids. So even creating the space to be able to have those conversations is a really, really powerful tool or intervention. Thank you, Guadalupe, for that. And then Zar says, encourage self-care activities, perhaps free or low cost. Yes, right. And so many of the when we think about self-care, it doesn't have to be these like really expensive, I'm getting this like spa treatment, getting my nails done, right? It can be free things. And in fact, some of the things that we talked about here are, can be considered safe self-care. If we think about, for example, bilateral stimulation, right? So many of us probably already engage in something like bilateral stimulation, either through biking, maybe we walk, right? Even just walking around our communities, there are so many ways that we can bring self-care practices, or that we can bridge self-care practices with these tools and these skills that can help people navigate mental health situations. And then Alexander,
Yeah,
I saw that you had your hand raised.
Mhm.
Thank you. I was just typing it up as well. Yeah, a lot of these key points are so relatable to myself and what I'm doing over here. But also reminding those community members that do reach out that it's okay, right, to be in the unknown, that they're not alone. I had a lot of experiences yesterday, and I hope it's okay that I share that. In particular with a Latin mother who her 16-year-old son was coming out to her as gay. LGBTQ, and she really didn't know how to navigate. I mean, this lady was almost in tears as far as stating that she was scared. She didn't know how to express that she loved her son, and I think really in our community is just really sharing that it's okay to not know, to reach out and to say, hey, I would like to come to a place that's more visible, or showing them and bringing the community together with others with those lived experiences. For example, like that mom will be coming over to the collaborative to see more individuals that might be relatable to her son and her son's age, whatever their pronouns are, specifically because this particular youth is wanting to express their gender in a very feminine way. And knowing our Latin community and the struggles within that, and hearing the mother being in a very place where I don't know how to tell my son that I love them regardless, I don't want them to be discriminated against, very scared mother, and just kind of giving them that support and saying, hey, you're not alone. There are other parents like you. There are other members like you. There are, and bringing them together to conversate and to kind of bring that fear down and letting them know that it's going to be okay, and that's what the community is here. And that's why we're trying to better these resources that we have here. Yeah, so I'm really looking forward to seeing that mother come in this week with her son, and being able to connect them with one of our peer support groups. Our lead on that, Catalina Zambrano, is very knowledgeable in those areas as far as gender expression, pronouns, and being able to speak on that also to our Latin community. Our peer support group is called El Bienestar Familiar, where we bring parents and their kids together to be able to have those troubled conversations. And my parents are actually going to be a part of it to tell their experience with, myself coming out as a trans man, and my younger brother being a gay Latino man, so just continuing to reassure that community. Yeah, just continuing to reassure the community, like, hey, we got you. Like, if you feel lost right now, it's okay to be in the unknown. You're not alone,
Yeah, and I love that you all are creating opportunities for peer-to-peer support. I'm thinking about like how powerful it would be to bring in something like the safety planning tool, maybe translated to, if it's a largely Spanish speaking community, right? Translated to Spanish, to do that in community, right? Like if parents are coming in with their kids, let's create safety plans for each other, the parent and the child, right? Because it's not just kids that go into crisis. We know parents do too.
Yeah, most definitely. And not to take away from everyone else or from the conversation, but yeah, if we do meet in private, I would love to introduce you to Catalina also to have that conversation.
Yeah, absolutely. But that's beautiful, right? Thinking about how we can create more peer-to-peer spaces.
Yeah.
And then, sorry, I just saw that Meg said in the chat, showing up at community public safety meetings and advocating for and sharing resources for greater understanding of the need for thoughtful crisis care, working with committees and local organizations to support development of the kinds of continuum of care we have discussed in this series. Yeah, and you know what? I really appreciate this, Meg. Naming, showing up at community public safety meetings and advocating. We are so in Santa Barbara County, we have amazing youth here, right? And the youth at one of our high schools have just successfully advocated to get the police removed from their campus. They had a student resource officer who was armed on their campus, and they just successfully advocated through the school board to have them removed and to have them replaced with 2 mental health workers. And so there's currently an effort to do this at one of our other high schools, and it's the call out that's going right now is for white allies, because we know that the way that racialization works, unfortunately, when white people show up to, school board meetings, their voices are often listened to more, right? So what does it mean then, right? This is an example of how we can think about, as a light-skinned Latina, as somebody who is part white, right? What does it mean for me to leverage my privilege in a way where I'm, not necessarily like taking up space, but where I'm standing in a space like a school board meeting where I know that because of the color of my skin and all of the ways that our communities are racialized, these people are unfortunately going to listen to me more, right? So I appreciate you thinking about how do I show up, right? Listening to the people that are organizing already, right? For us, it's listening to the youth organizers who have spearheaded this entire kind of removal. It's called Cops Off Campus. And listening to their needs. So for us, what this has looked like is listening to what they need, writing up a script with them about what they want us to say at school board meetings, and then going and saying the things that they've identified as as important. So yeah, there's so many amazing ways that we can create or that we can work towards creating more equitable outcomes for our communities. Of course, right? None of these are, one-shot solutions, right? None of the issues that we're dealing with were created overnight. None of them are going to be broken down overnight. But you all have named so many ways that we can start making small interventions into the ways that our communities are able to access crisis care. Okay, I've talked too much. I know we need to move on. Can we go to the next slide?
Well, I think what I'm hearing in all of the feedback is overall just like connect to resources, have connection, whether that's a peer support, which I'm all for. I wish, like, here at my job, it's something I've voiced, like we need, peer supports for the trans population. But with all of that, you guys are all speaking to that brain state, right, of heightened emotion that can lead to a crisis. And again, the need for connection, whatever that can look like. So that is the kind of the theme coming up here, whether it's connect to resources or supports. But yes, I know I had put some stuff in here in that, we had time. Maybe I could elaborate a little bit more, but I really like that we got to hear from some of you today and that you have been dropping in the chat just kind of points of reflection and what you've gotten out of this. So with that, I don't think we have any time to get through these stories of how this was done.
Yeah, so if we can go on to the next.
Yeah, if we can go to the next, I believe, next slide. And there you go. Like Ileana said, if there's anything you all want to learn, feel free to place a TA request on the CARE website to request coaching, resources, training. This can be by us, me, other fabulous members of the team. But again, that's to no cost to you all.
And with that, I think that we will pass it over to Eliana. Again, appreciate you so much. Email us, please, if you have questions or if you want to continue these conversations, we're available.
I cannot thank Ali and Bella enough for this incredible cohort coaching series. Take good care, everyone.
Thank you, everyone. Take care.